All right, welcome to chapter 32, the last bit of content for the whole semester. Congrats, you made it. We all made it together. And today we're going to end with depression and anxiety disorders, probably the most common condition that you will see because we actually have talked about it throughout many of the different lectures throughout this semester. And today we get to focus more on it. So, why don't we begin? Here are the main things that we're going to cover as a little overview. So we've got major depressive disorder, bipolar disorder, which is a disruptive mood dysregulation disorder, um, persistent depressive disorder, and then different types of anxiety disorders. So stuff like social phobias, manic disorder, OCD, and PTSD. So let's begin with the basic pathophysiology of all of these. They're not the best understood, as many of us will know. It's generally thought that a combination of environmental factors and genetic predisposition lead to the development of these conditions. Also, specific events can trigger them, so traumatic or stressful life events. And they have a bidirectional relationship with other chronic diseases. So, what this means is sometimes having these conditions, depression and anxiety, can lead to the development of other chronic diseases, but also in the opposite direction, having other chronic diseases can lead to the development of depression and anxiety. And that's why it's so common, why we see it so often. Now, a note about both of these is that um, these individual, I guess, aspects of depression and anxiety are not entirely bad. They do facilitate appropriate responses to life stressors, but the problem is when it becomes chronic, and it disrupts life when it shouldn't be disrupting life, essentially. So that's just a little like note to put at the start before we actually talk about um, these conditions. So let's talk about major depressive disorder, or MDD. So this is the leading cause of disability among adults in the US. And approximately 16% of adults will meet the criteria for MDD throughout their lifetime. Um, what that criteria is that they have to meet at least five of the following symptoms occurring on most days for at least 2 weeks, and also that can't be explained as effects of medication or substance abuse. So, depressed mood most of the day, diminished interest in or pleasure from most activities, significant weight loss or gain, or a change in appetite, altered sleep patterns, psychomotor agitation or retardation observable to others, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think or concentration, slash indecisiveness, or a recurrent thought of death or suicide. Now, bipolar disorder is also referred to as a manic depressive illness, and it's atypical shifts in mood, energy, and behavior. So typically you have the manic phases and then or episodes and then depressive episodes. So the manic episodes are typically accompanied by things like extreme euphoria, hyperactivity, and impulsivity during the manic episode, and then during the depressive episode feelings of intense sadness and a feeling of hopelessness. Now, there's a lot of individual variation with bipolar disorder. Now, sometimes these episodes can last days and then switch to, the other one, or it can last months. So, um, yeah, how an individual deals with it is going to be very different compared to the next individual with bipolar disorder. Okay. And then we have persistent depressive disorder. So this is relatively similar to MDD, but it's not as severe. So it's a chronic type of depression that's characterized by a consistently low mood. So they have a lot of the same symptoms as MDD. So stuff like low energy, sleep disturbances, changes in appetite, and all the other things that come with major depressive disorder. Um, but again, not as severe. Also, they may be, in general, more irritable, stress easily, or experience anhedonia, which is the inability to derive pleasure from activities once found enjoyable. Yeah, they're clinically technically separate, um, but yeah, persistent depressive disorder is often seen with other types of chronic conditions that we've talked about in this semester. Okay, and then lastly, we have anxiety disorders. So it's a large group of illnesses that include social phobias, panic disorder, OCD, PTSD, and GAD. So the typical symptoms are excessive worry, apprehension, fear, and uneasiness. But this kind of like bipolar disorder, there's a lot of individual variability in how it affects a person, what the triggers are, so on and so forth. So, as I mentioned at the start, certain levels of anxiety are actually required in day-to-day life. For example, when you have a deadline, sometimes that anxiety you feel to get something done is there for a reason. It's to kind of pressure you, to do your best work or to get something done on time. And so essentially, it can be helpful, but it's when it's chronic that's the problem. And specifically for anxiety, this hyperactivation of the sympathetic nervous system leads to increases in things like blood pressure, resting heart rate, perspiration, and blood flow to major muscle groups. And this chronic stimulation of these stress responses that typically should be acute and, situation dependent often exacerbate or cause cardiovascular disease, immunosuppression, or major depressive disorder. So, what typically accompanies these conditions are things like heart palpitations, tachycardia, muscle weakness or tension, nausea, chest pain, dizziness, and shortness of breath. So, how do we manage these conditions? Well, um, there's of course pharmacological intervention, which I will talk about in a few slides. There's cognitive behavioral therapy, which we've talked about in the past for other conditions, dialectical behavioral therapy, and then of course exercise. Now, the book inserts, and I honestly agree, that exercise should really be considered as a potential first-line treatment for anxiety and depression. And it's not just because, oh, it'll make you feel better, just like these abstract thoughts, but it actually has been shown to be pretty effective, especially when you compare it to stuff like antidepressant medication for mild to moderate depression. Also, um, oh man, what's the word? The adherence. The adherence to exercise is actually really similar to the adherence to medications. It's about 60 to 80%. So there are many reasons that we've talked about in different lectures that exercise can help, but specifically for depression, which we'll talk about in a few more slides in more detail, it should really be considered as, you know what, let's try this as the first line treatment before medication. And even if that's not the case, when it's an adjunct with medication, it's actually still helpful and it really augments different aspects of it. So that's just a little note here that we'll talk about again very shortly. But here I want to mention some medication that people may be on if they have either depression or anxiety or bipolar disorder. So this slide here is for depression. So most common ones are SSRIs or selective serotonin reuptake inhibitors. And some general, I mean, there's different types of SSRIs. So just a note here, I'm listing the groupings of these medications. So make sure you really take note of exactly what people are taking if you're working with them. But yeah, some of the side effects or adverse effects are fatigue, dizziness, and headaches. Also, because it's a massive list, it's table 32.1 and 32.2. I'm only listing the side effects that are specifically going to impact exercise with them. So that's just a little note for you guys. There are more side effects than this, unfortunately. Um, but yeah, that's what we have with SSRIs. And then we have SNRIs. So those are selective serotonin norepinephrine reuptake inhibitors. And these have the same side effects as the SSRIs, in addition to sweating and a faster heart rate. And then we have TCAs, which are tricyclic antidepressants. Um, and in general, the side effects are more adverse than SSRIs and SNRIs. So in addition, we see changes in blood pressure and blood sugar, and in hopefully it doesn't happen, but in the adverse case of an overdose, there's also life-threatening cardiac conduction abnormalities. So could be really dangerous. And then we have the oldest type of treatment, MAOIs, which are monoamine oxidase inhibitors. So these have similar side effects as SSRIs and SNRIs, in addition to extreme hypertension. So as you can see, depending on the person, they may be prescribed maybe one of these, maybe two, who knows, but the way it affects them is going to be very different. Now, for bipolar disorder, typically people get prescribed lithium, and often that's enough to take care of the manic and depressive episodes that they may have. And some of the side effects they experience are that, for one, they will require frequent blood test monitoring, and they may also have tremors, weakness, and twitching. And then for anxiety, there's various different types of medication people can take for anxiety. And they're not typically like grouped together as much. So again, know exactly what they're taking, and the table will also help you. But I've just listed some of the general um, side effects that they have. So we see same side effects as SSRIs in addition to fatigue, dizziness, and insomnia, headaches, fast heart rate, sweating, drowsiness, dizziness, decreased alertness and concentration, impaired coordination, and fall risk. So there are a lot of things to watch out for on the medication side. And because of that, before you even think about what the response is to exercise, gather a thorough medical history and listing of current medications because some may reduce functional aerobic capacity, affect perception and coordination, or reduce the desire to be physically active. Also, in some cases, psychomotor retardation can cause a visible slowing of motor movements and reaction time. So note that as well when you're going to make an exercise plan. Okay, now let's talk about exercise training. Now, let's talk about depression. So, as I mentioned a little earlier, there is quite a bit of research to show that exercise is really, really effective for helping with depressive symptoms. So, regular aerobic exercise is equal in effectiveness to some pharmacotherapy treatments in mild to moderate depression. Now, this doesn't mean it'll work for everyone, right? There is individual variability, but this is really encouraging, really, really encouraging. Um, there has been a dose response effect that's been noted in research. Now, more research is needed to fully establish it. However, we see some research to indicate that the I guess volume that they should do or the dose of exercise is consistent with CDD4 recommendations, which is great. That'll set them up for overall well-being even into elderly age. So that's great. And then there's also some indication that high-intensity progressive resistance training is more effective than low-intensity training to reduce depression. And it's mainly because of a direct relationship between strength gain and reduction in depressive symptoms. But again, these are relationships, they're not exactly cause and effect, so more research is necessary to note it. And another really interesting point is that relapse into depressive episodes is less likely with exercise as compared to antidepressant treatment. So if were not somehow convinced already that exercise should be considered as a first-line treatment, that's a pretty good reason. Now, why is exercise so helpful for depression specifically? Well, there are some thoughts, and it's probably multifaceted, but um, some ideas are psychological, so stuff like self-efficacy, gaining a sense of mastery, distraction from negative thoughts, and enhancing self-concept. So all of those things may aid the depressive symptoms, but there's also some other improvements. So things like improving the sleep quality and circadian sleep cycle. So if they get better sleep, then, often, even people without depression, if you ha go on a stretch of not getting good sleep, you're not going to have the best day. At least that's how it is for me. Um, so for a condition like depression, getting really good sleep and exercise helping with that sleep can be really important. Also, there's some biological pathways. So, um, it may exert effects on the hypothalamic pituitary adrenocortical axis, central norepinephrine neurotransmission, and serotonin synthesis and metabolism. So it can help in those facets as well. And then there's also one hypothesis here that major depression may be linked to a decreased hippocampal volume and a decrease in the synthesis of new neurons in the hippocampus. And so, as we talked about last time, hippocampus is important for Alzheimer's specifically. It's critical to functions such as long-term memory and spatial navigation. And so stuff like antidepressant medication and exercise enhance the synthesis of hippocampal neurons, just like we talked about for Alzheimer's. Um, so all of these reasons may be why exercise helps so much, but honestly, the one specific mechanism is not fully known. So look out for more research to clarify that as the years go on. Now, unfortunately for anxiety, it does help. It really does help, but the effect isn't as um I guess prominent for for anxiety. So exercise training significantly can reduce symptoms of anxiety when compared to no treatment or cognitive behavioral therapy, but there is a high degree of individual variability. Hmm. So yeah, that's just something to note here. Not saying at all that you shouldn't do it, but um, yeah, the relationship is not as clear-cut as depression. But as we talked about, people tend to have both conditions. So if they have anxiety and depression, then exercise training is doing its job to help. All right, so exercise programming. Now, unlike other conditions that we've talked about, there aren't too many things to watch out for here, just some more practical notes. Now, um, in general, if you want to do tests for these populations, that's fine. Refer to the ACSM guidelines if they're high functioning and don't have any other comorbid conditions, or use the CDD4 recommendations if they're low functioning due to comorbid conditions. And it's the same for general exercise programming, ACSM if high functioning, CDD4 if low functioning. Um, and overall, the goal is to achieve at least the minimum recommended levels of 150 minutes per week, which are what the recommendations are. Below 150 minutes per week does not show appreciable change in depressive symptoms. So dose is important. Now, some important points to keep in mind when working with these populations: keep the goals achievable. This is, I think mainly for the psychological improvements that they see, like self-efficacy and whatnot. So keep them achievable and maybe help them keep it achievable if they are setting too many lofty goals, as we all do. Plan activities that are based on interest and enjoyment. Leisure time physical activity is appropriate as part of an exercise program. Social support is important, and exercise environment is important and must be individualized. Another note that you may have to deal with this population, especially if, as I talked about at the start, if there are chronic conditions that stem from depression and anxiety or are the cause of depression and anxiety, um, motivating people to start exercising and to maintain it may be the most difficult thing that you have to deal with. So as long as you can help them achieve adherence, so, plan the activities that they want to do, that they're interested in, that they keep coming back to, that may be the most important thing for this group. So, yeah, that was the last slide of the semester. Hope you guys enjoyed learning about different different chronic conditions and how exercise helps them and how you can program specifically for them. And hopefully you feel more confident in seeing that, you know what, exercise with these populations is very doable and it's not as, scary as people may make it seem in the media. So, um, yeah, hopefully you guys will take these points and I hope it helps with whatever's next for you, wherever you want to go after your degree here. So, thanks for joining throughout the whole semester and um, maybe I'll see some of you around on campus. Have a good rest of your semester and good luck with finals.